before we get going. Just because I'm sharing my screen, I can't actually see messages coming in right now. So if I would love this to be an interactive conversation. So I strongly encourage people to send messages as we go, but just send them over to Dr. Holmes and she'll feed them to me aloud. And the other thing, as we're thinking about, we're going to talk about stigma, we're going to talk about kind of internal obstacles to getting care, but then we're going to talk about access too. And as we're going through this pandemic and the demand for mental health care has been through the roof, understandably, and we hit limits of how much we can do for folks individually, I've been kind of noodling around maybe doing some more groups this way, doing it, doing virtual groups and trying to just reach more people more efficiently, because we know there's way more need than we can meet with people one-on-one. So if you are interested in some kind of, online groups, definitely shoot a message and let me know, or let Dr. Holmes know, and we'll keep you posted as we kind of develop that. Because I think these webinars have been a great way to reach a bunch of people at once, and we can keep something similar to that going. All right, so today we're talking about, why don't you talk to someone? We often kind of hear that phrase, oh, maybe you should talk to someone, and it's actually a title of a great book by Lori Gottlieb. But we also need to think about, well, why don't people? Why don't we talk to someone? Why don't we get the help that we need? And just to put some numbers, actually, before we move on from this slide, I love drawing. I love whiteboards. You'll see there's a lot of whiteboards in this presentation, as in all my presentations. If you want to take a look at these later, you can check out whiteboardpsychology.com or find me on social media. Yes, so you could screenshot as we go, but you can also access these whiteboards later. All right, so just to put some numbers around this, I'm gonna put this all in perspective. We know that mental health problems are incredibly common. Before the pandemic, the stats were like 1 out of 5 American adults dealing with mental health problem in a given year. During the pandemic, that's way higher. And we know of those folks who are dealing with something, it's really not more than half of people who actually get help for their mental health problems. So if we look at kind of people who get treatment in a given year, that 45% number on the top, on the sort of left side, that's 45% of adults overall who are dealing with a mental health problem actually get help for it. And on the right column, you see how that's really there's really a disparity by different subgroups too. That white adults are kind of best off in terms of access, and even that is only 50%. And when you break it down into different racial groups or by sexual orientation, right, we're getting especially by racial groups and ethnicity, we're getting much lower numbers of the percentage of people who can actually access help. So it's really worth asking, what is it that gets in the way? Because it's not just the number of people who get it, but also how long it takes between when people start experiencing the problem to when people actually get the help. On average, that average delay is 11 years. And this infographic here comes from NAMI, which is the National Alliance for Mental Illness, and they're pulling these stats from the CDC and from NIMH. So these are some great resources if you're looking for data, and NAMI has just great resources overall for mental health education and support. Okay, so let's get into it. What is it that stops people, or what is it that takes so long? And so, I think we have to break it down into 3 steps that have to happen if you're going to get help for mental health problems. So first, you have to recognize that you have a problem to begin with. The second thing is you have to be willing to get help for it. And the third is actually accessing that help. So if you can make it through all 3 of those hurdles, then you and I, or any other psychologist or therapist, whoever you're working with, can actually help you. But before you even get to our office, you have to go through these 3 steps yourself. And that's what we're going to talk about today. I will tell you, I see about 200 people a year, and the vast majority of people have already gone through all 3 of those steps before they get to see me. There are a handful who skip the first 2. They've gone straight to access without recognizing they have a problem and without really being willing to seek help for it. And if I was to put a demographic profile, it tends to be men in their 50s, 60s, and 70s. It's not I mean, this is not super common, but it does happen definitely from time to time that I have somebody who comes and they say, I don't know why I'm here. I'm fine. I don't have any problems, but my wife told me I have to do this. So she made the appointment. And so among the people who kind of present that way, it tends to be, like I said, it tends to be men in their 50s, 60s, and 70s. Um, and in these instances, their spouse is very well meaning and very well intentioned, but the person who's coming in has skipped those two important steps, because I can't actually be of any help to somebody who doesn't recognize why they're there and doesn't want to be there in the first place. So I really encourage any spouses, family members, caregivers who are listening to this and maybe thinking about someone in your life who you think really needs some help. I'd really advise you to really start thinking about step one, getting to that point of recognition, and then getting through that part of willingness, because that's going to make our work just a lot more effective and helpful by the time you get to my office or anyone else you're seeing. So today we're going to talk about what gets in the way of each of these three steps: that recognition, the willingness, and the access. All right, so what makes it hard to recognize that I have a problem in the first place? There's a lot of reasons, but these are just a couple that I've noticed come up over and over again. So starting on the top left there, just not understanding emotions. Just a lot of us have a real deficit of skills and knowledge and awareness of what are we feeling and what are emotions and how do they work, and what are the signs that I'm actually not okay, because we can tell ourselves we're okay consciously, but we might not actually be, and we just might not even realize what the mismatch is. Um, and I think a lot of that is a reflection of, culture, and there's a big generational split. Definitely noticing there's much more of an emphasis now as kids are growing up to get some of these sort of social emotional skills. But if nobody taught it to you, then it's really hard to even know kind of what is going on and internally, and what do you do with it. So that's one piece. Often what makes it hard to recognize a problem is we're just too busy. We're just too preoccupied. And, we definitely see this in, when you're working or you're a caregiver, you're a parent, you've got a bunch of other responsibilities, you've got a lot going on in your life, you're thinking about other people or other projects and things, and we just don't even have the time or opportunity to just to check in and really ask ourselves in an honest way, how am I doing? Um, and that really goes hand in hand with what I call boiling frog syndrome, which is, often this stuff, it's not like you wake up one morning and you've got a raging mental health problem. That's usually not the case. And if it was, that would, often sort of point to maybe being like medication induced or something kind of external physiological. The way this stuff develops is it comes on often kind of gradually. And so because things can kind of creep in, maybe you're just feeling like a little bit off one day, and then you're still a bit off, and then maybe you're noticing that your heart is racing and it's a little bit harder to concentrate and you're not sleeping, and these things just sort of creep in, and they might get worse and worse. But as it goes, there's not a discrete starting point that says, oh, now I have a problem. So it's often hard for us to recognize it coming up. And another really big one, calling the hero complex here. And this is the case for healthcare providers big time, but it's also the case for police or national security or parents or caregivers or anybody who's in a professional or personal position where you are responsible for other people. You are the one who fixes the problems. You're the one who supports everybody else. You're the one who knows what they're doing, the one with the responsibilities, so everybody else can lean on. You're the rock. And so if you're that person and that's sort of your identity and your kind of picture of yourself, then you take on this belief that you can handle everything. And we tend to think of people, sometimes when we're kind of in that hero complex, we sort of split the world into, like, there's the people who help and there's the people who need help. And if I am a person who helps, then I am not a person who needs help, because those are two separate categories. And so we won't even allow ourselves to recognize that, well, maybe I can actually kind of go back and forth or be in those two groups at once. It doesn't even cross our mind. So these are just some of those obstacles that get in the way. So I want to take some time now to think about, okay, well, what are some of the signs that it is time to get help? And you can go through kind of checklists of symptoms of depression or anxiety or OCD or attention deficit or substance abuse. But the things that kind of transcend whatever the specific kind of diagnostic issue is, um, just the signs that it's at a point where it's where you do need some help. You can really benefit from some help when it's causing you a lot of, or somebody around you, a lot of distress. Sometimes we're not bothered by it, but it's causing a lot of distress to our loved ones, and they'll often tell us that if that's the case. Um, if it's really getting in the way of your day-to-day function, whether that's at work or just kind of around the house or in your relationships. Um, when we find ourselves pulling back from things from people, so withdrawing from other people is a big sign. Withdrawing from activities that we would normally enjoy or that are important to us. This is kind of tricky to recognize during the pandemic, obviously, because we've been withdrawing from everything. But now, especially now that opportunities are opening up to kind of do things again, there's a lot of that push pull of like, well, do I want to stay in my bubble versus do I want to re-engage? Um, Definitely when we're doing things that are kind of excessive, impulsive, risky, or any kind of addictive behaviors, those are all big warning signs. So those are things that maybe kind of show up on the outside. But in terms of like the kind of thoughts and the kinds of things you might be experiencing on the inside, um, a lot of times when we're having really difficult or disturbing thoughts, and definitely thoughts of harm to yourself or to someone else, that's a really big red flag. But even if it's not to that degree, if it's thoughts that you just kind of get stuck in, that you're ruminating in circles about, and you can't get things out of your head, the kinds of things there's sort of the signs also, you just don't feel like yourself. Maybe you feel really stuck. You kind of just don't see this getting better. And you don't know how to fix it. And you start to get kind of hopeless, like maybe I'm just stuck this way. This is how it is. And also sometimes we just get that, desperation is too strong a word, but that feeling like I can't sustain this. I can't do this anymore. So those are all some signs that it's really at the point to reach out. Okay, so sometimes we get past that recognition. It's okay, yeah, I'm not doing well. I'm having a problem. I'm really struggling. But do I want to talk to someone about it? Do I want to actually get any treatment? Um, and I will say, actually, sometimes these things are all on a spectrum, right? So sometimes the recognition that you're having a problem is enough to get you to do certain things to take care of yourself. Like last time we were talking about those 10 mental health hacks, and sometimes that's enough, right? You realize you have a problem, you kind of commit yourself to doing things to take care of yourself, and the problem goes away. So not everybody needs to see a therapist. I think mental health is important for everybody to be mindful of and manage, just like your physical health is important for everybody to be mindful of and manage, regardless of whether you have a serious chronic medical condition. But when it does get to that level where it is time to get some help, what gets in the way of that willingness? So a lot of things, but I think some of the most common reasons that I definitely see coming up are doubt that it's going to do any good, stigma from a public perspective, okay, what are other people going to think, or what's going to happen with my job, and then self-stigma, which is sort of the internalized beliefs. So if we're going to break that down a little bit, the kinds of thoughts that we hear that go along with that doubt, it's definitely, well, no one else can fix this problem for me. And maybe, yeah, you are in a kind of objective situation where, yeah, nobody is going to fix it for you. You have a very serious illness. You're caregiving for a spouse who has dementia and is declining. You suffered a really terrible loss. Right? No amount of therapy is going to bring that person back or is going to cure your spouse's dementia or anything else. And so sometimes we think, well, because the external situation can't be fixed, then nothing can help me. And what we really are trying to do with any kind of mental health help is that it doesn't, even if the external situation is horrible, there's always something that you can do for yourself in terms of your ability to cope with it and how you're going to carry on and how you're going to live your best possible life in the face of really, really difficult situations. Um, Sometimes the doubt comes from, okay, well, I tried it before, it didn't help. The person just listened and I didn't get anything out of it, or the person was trying to tell me what to do and it wasn't helpful, or the person was really judgy. Um, there's a lot of therapists out there, and every therapist has a different personality and a different style. And so much comes down to the individual fit. Um, so just because it didn't work once doesn't mean it's not going to work next time. But that does leave a mark because you have one bad experience, and this is just what we do, right? We tend to generalize and say, oh, okay, this is therapy, it doesn't work for me. And so when people have had a bad experience in therapy before, I think it's a really big opportunity because you can look back at it and say, okay, well, what didn't go well there? What didn't I like about that? What wasn't helpful? And then that can inform, how you're seeking it out next time. Okay, if I know that it wasn't helpful to have somebody who's totally passive and listening, then I know I'm going to look for a therapist who's going to be more kind of active and giving me more active feedback. Or if I recognize the kind of personality type that's kind of off-putting or didn't make me feel good in therapy, I'm going to kind of keep that in mind as I'm looking for kind of gauging people's personality. So just to really encourage people not to give up, even if you've had a bad experience. Um, Another reason for doubt is, okay, well, they won't tell me anything I don't already know. Yeah, I know all the self-care things. I know I'm supposed to, sleep hygiene, and I'm supposed to exercise, and I'm supposed to, meditate. But okay, so they can't tell me anything new, so that's not going to help me. Um, True, right? There's a limited bag of tricks that we have, and there's only so much new stuff that we can tell you, but it's often not, what you need to do. It's the implementing it. It's the kind of figuring out. Oh, is there a question there? All right. Oh, I can't. You're muted.
Sorry, there's a question a little ways back, but I had to make a little stop. So the question is on the recognition problem. So when you were talking about recognition,
Mhm.
what if you're dealing with someone who believes all the problems are caused by others?
Yes. Yes. That is a huge, that is a really big obstacle. And that is, that is one of the thorniest things that we deal with in therapy when people want to come in and just tell me that everything is because of the people in their lives. Um, and it can be really hard to get through to someone when that's the case, or if you're kind of recognizing that in yourself, well, my problems are all caused by other people. Well, let's say they are, let's say, but you can put that kind of in the category of, a loss or an illness or a really bad job, right? There are certain things we cannot change in our lives. But if we want to improve our lives and we want to improve, the way we're kind of coping and responding and dealing with the hard stuff, then all we can do is focus on ourselves. And think about what we can do for our own sake, even if our lives are full of difficult people who are making our lives hard for us. Um, so that is definitely one of the biggest hurdles. Um, and so yes, I always come back to the question of, okay, yeah, what's in your control? And if people have made it in, you've made it into therapy, you can only work on the person who's in the therapy room. You can't do anything about the people who are on the outside. You can change how you communicate with them, maybe, but you never have a guarantee that they're actually going to change back. Um, any other? Well, you'll let me know if there's other questions. All right, so that's doubt. Public stigma, I think we're all familiar with this, right? There's the fear that, if people find out, they're going to think I'm weak. They're going to think I'm crazy. They're going to think I'm unreliable. They're going to treat me differently. Definitely, in certain professions, this comes up because you get asked about it. A lot of people, in this area, in the DC area, have security clearances, and it's like, oh, well, I'm going to get asked about my mental health history, and I'm going to lose my security clearance. I know in a lot of healthcare professions, well, am I going to get asked about this? My licensure, and I mean, there's a lot of really tough stuff on a kind of a systemic level that I think is improving. I think it's getting better. But we're often kind of work dealing with this system that's, you know, unfortunately disincentivizing people to get help because they think they're going to be punished for seeking help rather than rewarded for recognizing that they have a problem and trying to do something about it. You know, I can't speak in every case if people don't get, you know, people are going to get screwed over or not, but I know just from kind of being in the working with folks in the military world a little bit, often with security clearances, um, they just want to make sure that you're not, you know, they don't want to make sure that you're not a national security threat, that you don't have secrets that someone's going to blackmail you for, that, you know, you're doing the responsible thing and getting the help. So I've worked with a lot of folks who, you know, it's not fun to disclose it, but they often found that it went a lot better than they expected, and very few people, I believe, from the latest numbers I'd seen, actually lose their clearance over it. But yeah, I mean, it is, we, you know, we got to be honest about the reality of it. Sometimes you have to, you know, you get in these positions where you're asked to disclose mental health history for professional reasons, and that's a tough one. Um, and then and then we get to this question of self-stigma, which is, you know, when we've internalized these beliefs about ourselves. So, you know, the kinds of thoughts we're going to hear there are, you know, I should be able to fix this myself, or, you know, asking for help is a sign of failure, or, you know, I'm supposed to pull myself up by my bootstraps. And, you know, often with healthcare professionals in particular, it's like, well, I know better. I shouldn't let this happen to me because you know, I should know better than to let this happen. And I should be able to fix it myself because I have the skills and I have the knowledge. Um, or this thought, okay, well, if I seek help, then that makes it real. And then I get a diagnosis. And that means like now I'm a person who's seeking mental health help. And that means I'm a person who, you know, who has a mental health problem. Whereas if it's just like something I'm dealing with myself, and I can kind of tuck it away. Um, you know, and I'll share that on a personal level, that is 100% the attitude that I had in my 20s when I was noticing signs of depression, and I was like, ugh, well, if I go get help for it, then I'm going to get a diagnosis, and then it's going to be a thing, and there's going to be a paper trail, and I don't want that. So let me just ignore it and it'll go away on its own, you know, which only really works up to a point, as I, you know, learned later. And often we kind of have to learn the hard way that you know, when we face it, we're actually putting ourselves in a position of a lot more strength, because then we have the tools to actually deal with it, as opposed to sort of ignoring it and letting it fester. But we do have to take that leap, and that is a really hard leap to get past. So, okay, so now let's say you've made it from the point you've recognized there's a problem, you're willing to get help for it. Well, now we've got this question of access. Um, and this is a tough one too, right? So, you know, I'm sure a lot of these kinds of things will be familiar to a lot of folks, right? It's like, well, where do I even begin? You know, what do I know how do I know what to look for? There's all these different mental health professions. Like, how do I know the difference between a psychiatrist and a psychologist and a social worker and a counselor? And, you know, you're trying to navigate this whole maze of, you know, there's a lot of people in private practice, so that's all a separate phone call or email, and that takes time. And how do you know who's going to be a good fit for you, because it's so personal? And how am I going to fit this into my life? And you know, why doesn't anyone have openings? That is a really tough one right now, because the pandemic has really driven up the demand for mental health care. And especially if you're limited by insurance, then that is another big challenge. And this is something that's kind of tough about the system that we're in, is we do have this sort of two-tiered system, which is very unjust and frustrating, right? So if you can afford to pay $250 a week out of pocket, then you have a lot more options than if you need to stay within your insurance. So all of this makes it really hard. And so when I think all of that definitely deserves a lot of attention and sort of thought to how we can kind of get people through some of those access hurdles. Um, but, you know, overall, when we're looking at, okay, well, what is it going to take to get somebody in to get some help? We want to make sure we're really looking at, okay, well, where are you getting stuck? Is it recognition? Is it willingness? Is it access? And depending on kind of where you are and what's getting you stuck, then that's going to call for sort of a different, different kind of response or approach in terms of getting you past some of those hurdles. So it's 12:30. That's what I have in terms of the whiteboards. And I thought for the rest of the time, we could talk a little bit more, just kind of free flowing, depending on sort of what some of the questions are and what people are interested in hearing. I can definitely we could talk about sort of strategies at each of these levels, but let's see where things are at now. Do we have any questions so far? Give you a chance to swallow.
Sorry, I was eating. Okay.
Lunchtime.
Lunchtime, you do it. So, this is a really like personal one. So I'm gonna take my time to make sure that I read it correctly. One of our members saying that she's had several miscarriages in the past, and has also failed with IVF treatment. When she tried to have a second child, and she went through it for 8 years. She's now 44, and she's finally, her words, and finally gave up on my desire for the second child that can complete my family. It has been 8 years. Sometimes I feel sad and still think about the loss and cannot have another child. Adoption is not an option for me. How can I live my life more happily without thinking about the second infertility that I experienced? Is this considered as a mental illness, and do I need to see a therapist?
So, mental illness. I'm gonna go on get on my soapbox for a little bit. I mean, first, I am so sorry for all of your collective losses. I mean, each miscarriage is, is such a loss and a trauma, and to go through, that and the kind of the hope and the grief and that cycle of the up and down is, that's horrible. And I'm so sorry that you've been through that. Is this mental illness? Look, if you're going to go through insurance, insurance will only pay if there's a diagnosis attached. So technically, yes, if you want to see somebody, then you will get a diagnosis. And I think that definitely for me in my 20s, that was the get like the kind of like the pushback that I had. It's like, I don't want a diagnosis. And I think we just attach way too much weight to diagnosis in terms of, oh, that means I have a mental illness. And what does having a mental illness means? It means I'm, crazy, I'm broken, I'm weak, I mean, we look at the broad spectrum of physical health and medical conditions, right? And you can go see your doctor and for for seasonal allergies, and there is a diagnosis, and you can go, you can have metastatic pancreatic cancer, horrible, aggressive, deadly disease. Those are different medical conditions, and to have a medical condition means, in and of itself, that means nothing. Because there's so many different kinds of medical conditions out there, right? And we know that, and we accept that, and we see doctors all the time for all kinds of different things, and it doesn't have that gravity. But we say, oh, do I have a mental illness? It's like, oh, does this put me in this box? And so just getting a mental health diagnosis, I would like it not to be such a big deal. Because the truth is that about half of people, I mean, that's the stats too, that about half of people have a mental illness in their lifetime. And that word mental illness has such baggage. So now people are saying more like mental health problem. And it's, the words are just words. But, it sounds like for this particular person, you're suffering, you've been through a lot. I do think it would be really helpful to see somebody. You have a lot of grief to process. You have a lot to, and grief not in terms of just, each miscarriage, but also we think about grief as the, giving up on your dream, giving up on your sense of, the idea that you had for what your future was going to look like, and what your complete family would be. So yes, that absolutely warrants seeing someone. I think it could be really helpful, but does that make you have a mental illness? If you see someone who takes insurance, you will get a diagnosis, but I don't want that to discourage you, and I don't want that to change how you think about yourself, because you're experiencing the normal grief and trauma reaction to a horrific situation. I hope that helps.
So another question that I got is a very interesting one. Um, so talking about like solving problem for patient. When you have a patient that's had a particular condition for 20 years, which they say is equal to 175 hours of their life, how can you, what it took 20 years to learn can be undone in say 2 or 3 hours per week of therapy?
Good question. Totally fair point. And I think that gets to um, actually there's a really big takeaway there for anybody, even if you haven't been dealing with something for, what was it, 10 years, 175,000 hours. Um,
It was
even if it's
20.
something 20 years. So, I mean, even if it's just been 2 months, it's still making a difference through therapy is going to take more than, we get 45-minute sessions once every 2 or 3 weeks. That's nothing in your day-to-day life. So, therapy is a place to, yes, it's a place to come and unburden yourself and have someone listen to you and get the support. But also, ideally, therapy is giving you things that then you take and you apply in your day-to-day life. And it's work. It takes practice. And it takes kind of applying different tools, different ideas to actually make change in terms of your mindset, how you manage your emotions, your habits, your behaviors. Um, the magic of therapy is not just the 45-minute or 50-minute session, but it's what it does in between. And that willingness to seek help is not just the willingness to show up at a therapy office or a virtual visit, but it's the willingness to kind of own whatever it is that's going on with you and to kind of approach it, and sort of commit yourself to, okay, I want to help myself with this. Um, but yeah, I mean, when something has been, and in terms of expectation settings, if something's been going on for 20 years, I don't think therapy is likely to eliminate it, but the hope would be that it's going to make it more manageable. So maybe it's not taking over your life, but you think about what's important to you and how you want to live your life, and how whatever this thing you've been dealing with for 20 years, is it getting in the way of your relationships? Is it getting in the way of you doing something that gives you a sense of purpose? Is it getting in the way of you feeling proud of yourself and feeling like you can kind of accomplish something meaningful? And so that's more what I would be kind of steering you to, rather than let's just eliminate this problem that it's not going to go away. Yeah, go ahead.
Okay. So, oh, hold on, little glitch there. So I have another question. Is it normal that I helped me and my family get through the pandemic and felt like we were resilient and we persevered, but then now that the pandemic is more kind of under control or things seem to be settling down a little bit, now I feel anxious, can't sleep, and can feel myself overreacting to things that I could once handle.
Thank you, thank you, thank you, whoever you are, for saying that and for asking that question, because that is, oh my goodness, that is such a huge phenomenon right now, and I am very appreciative of you just, because that is so common and so important. Um, a little There was some kind of resources or things you can Google. There was a recent article in the pandemic in the Atlantic, by Ed Young, who has just written a lot of great pieces throughout the pandemic, about trauma and the pandemic and this sort of post vaccine phase that we're in. And there's a line in that article. It's like when you're swimming across the ocean and you finally get to dry land, you don't expect to feel like you're drowning. And that is what so many people are experiencing in this moment. It's like we've gotten through everything that the last 15 months have brought, and it's finally there's this hope, and there's this return to normalcy, and there's this relief, and we feel like, oh, I should be so happy right now. I should be so grateful. Why am I miserable? And it makes no sense. And then we feel like, oh well, there's something wrong with me for feeling that way, because that. Um, I could draw an analogy to, I started in cancer before coming to Rockville Internal Medicine Group. So from grad school and my last position. So when people are dealing with cancer, often, the initial diagnosis is really hard. And it's like that initial stage in March last year, right? When everything was upended, it was like, oh my gosh, what's going to happen? We're all going to die. That was terrifying. And then, so going, with the cancer diagnosis, you get the diagnosis, it's shocking, it's horrible. And then you say, okay, well, what's my treatment plan? Okay, I'm going to do chemo and surgery and radiation. And yes, there's a lot about that that's miserable, but you have a next step and you have a treatment team and you have a plan and you're just going one step in front of the other, 1 foot in front of the other, one step. And people get through that, and then you get to your last day, and at the hospital I was at, I think this is true for a lot of places, your last day of chemo, they like ring a bell and everyone's congratulating you, and you feel like, oh, I should feel so relieved now because it's over, and the worst part is over. And then the impact hits people, and then it just everything about everything that you've just been through, it all kind of comes crashing down. And then people say, well, what's wrong with me? Why do I feel this now? I should be grateful that I'm alive. Why am I not happy? I should be feeling like I'm back to normal, but I'm not feeling back to normal at all. And that's the phase that we're at now. It's like you finally have a moment to breathe. You're finally no longer in survival mode, and it all comes crashing down. So you are definitely not alone. You are in very good company, and I think we all need to give ourselves some time to process and recover and deal with all the stuff that's hitting us now.
That is so true. I was talking with a friend of mine about their children, and she was saying how when her children, they thought everything was fine, and then just realized, like, whoa, I'm anxious being out in settings that I used to be comfortable with. Wasn't even expecting it.
Yeah. Yeah. I mean, and at the very beginning, you think how people were like, oh, okay, well, when the pandemic is over, I can't wait to blah, blah, blah. If it was a matter of, okay, things were shut down for 4 weeks, as, oh, now I can go back to the movies, great. When you've been trained to believe and to understand that, going to a concert, going to the grocery store, even these could be fatal activities, that's to and then live that way for, a year or more. And then try to resume your life again. It takes some time to kind of retrain our brains and to sort of assimilate the new information we're getting. It's okay, well, am I safe now? Well, what can I do? And this feels really weird, even though rationally I'm told that this is fine because I'm vaccinated. It takes some time. It's just going to take some time. Yeah.
So how do I know who to seek out, like a counselor, a psychologist, worker, psychiatrist?
Good question. So this is so hard. So psychiatrists, that's actually kind of the easiest one. Traditionally, psychiatrists back in the day did a lot of therapy and medication, but generally, there are psychiatrists in private practice out there who do therapy, but most of the people that you're going to see, and definitely people who take insurance, they're doing medication management. Psychologists versus clinical social workers and licensed counselors, there's a lot of overlap. Our training is different. I, as a psychologist, I have, my own kind of like biases and beliefs about, what our training is. And I just don't know as much about the other training. I mean, master's level training versus, we go through, but a lot of people, at master's level, they do a lot more training after they get their degree. So there's a lot of variation. So, degree matters up to a point, but also I'd be thinking a lot um, about fit, about what their experience has been. If they are experienced with the kinds of issues that you have been dealing with, if their approach to therapy seems to be kind of in alignment with what you need. Yeah.
So there's another question, but the attendees are saying there's some feedback. So they're suggesting that you mute while I ask the question. Okay, did that take care of the feedback? Oh, dude, it sure did. You guys. Okay. So another question that was asked was, what is the first step to finding someone to talk to? Would you recommend talking to your primary care doctor?
Unmute. Yeah, so definitely talking to your primary care doctor is a really good first step. And I think a lot of people might not even realize how much our primary care doctors are dealing with. Well, Dr. Holmes could attest to this more than I can, but just how much time you guys spend dealing with depression, anxiety, stress. Your primary care doctor is not just there for your body, but they're there for your mind, soul, relationships, everything else too. And primary care doctors are really looking at you as a whole person, and they're not just looking at one part of your body and one organ. In terms of finding somebody, we have a tough non-system. It's ridiculous. So it's very decentralized, and it is a process. And so I just encourage people to be patient and have some persistence. Psychology Today is a directory where you can find therapists, and you can search by insurance, you can search by geography, and the specific issue areas, and you can see their profile. And so that is one way that can be helpful to find somebody. There are several practices that we refer to. So because we're limited here with just very short term, when people need more than what we can do, we refer out. There are a lot of practices we refer to, but during the pandemic, a lot of them are full or have wait lists. And so, I give out their names anyway. You just never know at any given moment who has openings. So there's no easy answers there. But start with the primary care doctor. You can see for us, for me and Dr. Park, even if this brief therapy is not going to be enough for you, for some people, it just gives a place to get started. And if you can tell me kind of what you're dealing with, what you're looking for the people who have the privilege to go out of network, this is just, it's so unjust, so it bothers me, but it's the truth. If you have the financial resources to go out of network, I can give you much more personalized recommendations. If you need to stay in network, the options are more limited, but we do our best. And we just have to kind of be persistent. And I would recommend emailing potential therapists rather than calling, because a lot of them, you often don't get a call back just because they don't have the time to call everybody back. But it's a lot easier for them to email you back real quickly. So email rather than call if you have an option.
So I just want to piggyback off what you said. You're right, it's so hard. I actually had a pretty good person that I could refer to for patients, for psychiatrists, because I'll manage things that I think I can manage, but definitely when I feel like I get outside of my little wheelhouse, I'm like, okay, we need to send you on. And so I had a referral person that I could refer to, because they accepted most insurances. There were a few that they didn't, but most insurances they accepted. And I had a patient that I sent to them, and the patient called, they're not taking new patients. And I'm like, I don't know what to do. Hold on. And so, but I told the patient, they're kind of they got kind of such an influx, not just from me, but they got such an influx that they're now kind of doing a rolling thing. So I, tell patients, be patient, let's work with, that's why I think, therapists and psychologists are very helpful, because we can work on things, because medication, again, it's a tool, just like therapy is a tool. And so, I believe that sometimes the two tools work best together, but, being able to kind of do that while we're doing something else. And so then this brings me into the next question, which is how do you go to a family therapist to work through issues regarding like an adult child when you don't know that the child is coming or going to you, or the child isn't coming to you? It seems like it may not be very effective, since it seems to be one-sided. Like if it's just you and the therapist, like working on it, but the child is missing. Even they're an adult child, they're just gone.
Yeah, this kind of thing comes up. This is really hard. Anytime people are coming to therapy because they're having difficulty in a relationship, if the other person is not present, it's you can't make any changes on somebody who's not present. So if they're not, I mean, you can have conversations with them about, seeing the value and approaching this together. So if you can get them into the room, then that's really ideal. If you can't, or until you can, use the therapy time to think about, okay, well, what is your part of this? How are you approaching things? How are you communicating? Let's talk about, your communication skills and how you're responding to them and how you're, if you're getting, kind of sucked in or getting reactive. And, we all have to own our part. But the bottom line is if somebody doesn't want to show up, you're not going to change them if they're not in the room.
Yeah, I think that, I really love that question, because, it's like, I think it, it's really kind of true that you have these issues where it's like, it, it kind of brings me back to that first question, like, what do you do if it's like the person is like, it's everybody else and it's not them, it's actually, everybody else, but it really is them. And I always think back to a friend of mine, we're no longer friends, but that's neither here nor there, that I used to talk to. And so she would talk to me about like things that, were going on in her marriage and things like that. And I had suggested like, maybe you should go see a therapist or a marriage counselor. She was like, child, he ain't gonna go. And I was like, well, you could still try. And so she, set up the group therapy session. And of course, hubby didn't show up, but she still went. And so she, was able to talk through stuff. And while, there were things that were still not right within the marriage, she got tools and learned how to change her expectations and how she dealt with them, and how she fed that. And so I, she was like, you were right. It didn't necessarily help our marriage, but sure did help me learn to deal with our marriage better. And I was like, well, there you go.
Yeah. Do we have any other questions?
There was another
There was
question that
another question that
Oh, sorry.
there was another question that I had answered, but I think it was sent maybe to me privately. So I want to make sure, just in case anybody else has this question, I'm going to go ahead and bring it up. If a patient has already received assistance from like yourself or Dr. Park, and they're still struggling or even facing like a new issue, is it possible to see you guys again? Is it kind of like a one-off and done?
So I've had to kind of evolve with my boundaries as we go along. I never want it to be, okay, well, you've hit your 8 sessions, the door shuts behind you, you're, goodbye forever. I'll never see you again. That's not really the intention here. So the intention with the limits is to differentiate it from ongoing therapy, and to allow us the ability to kind of take new people on, because there's always a demand in a practice with what, 30, I tell people 30,000 patients. I think that's about how many patients come through RMG, and just 2 psychologists. We're hiring a third. If anybody knows a psychologist out there who wants to work with us, we are hiring. So I think about it as episodes of care. Kind of like you're getting on and off the therapy train at different points in your life. So I've been in RMG for, it'll be 4 years next month. I have a lot of people who I've seen for more than one episode. So maybe it's like they'll come back like a year later, 2 years later, 18 months later, and it could be something totally different. So that is the model working as it should work. I have some people who kind of have thought about trying to kind of like engineer the system, and it doesn't work. They're like, okay, well, if I do my 8 sessions, how long do I have to wait before I can come back again? Okay, so let me do my 8 sessions, and then I'm gonna, wait 9 months, and then I'll. No, if you feel like you're gonna need more, let's get you to somebody who you can see on an ongoing basis, because having to kind of like artificially pause, and then restart is not actually going to be helpful. And I don't want people to try to kind of squeeze their, like, it's a like round peg in a square hole. Um, but um, but the appropriate way for our system to work is when, needs pop up and change over time. And generally, like spaced out, I would say like 9 months to 12 months apart is sort of, kind of resetting the clock on an episode of care. Um, I don't have a very rigid formal cutoff, but that's generally what it tends to be. But I really just encourage people to think about not use that to try to like game the system, but just think about realistically what you need and if it would be more helpful to see somebody on a regular basis.
So after spending the last year at home with significantly reduced social interactions, I'm having trouble reaching out to reestablish relationships. Do you have any tips for getting out of your new comfort zone and reestablish these dormant or those dormant relationships?
That is a very good question, and I'm sure a very, very, very common, I think a common thing a lot of people are struggling with. There's this psychiatrist in Florida, I think his last name is Bregman, who coined the term cave syndrome. If you Google cave syndrome, you will find a lot of hits. And that I think that phenomenon, having the name for it, it really took off because people identify with that. You've gotten used to being in your cave for so long, it feels really weird to get out. Our social skills have atrophied, and we don't really know how to make small talk anymore, navigate the world. So, I would say start with think about the people who are most important to you, people who've been really missing. Start with people who are the easiest to be with and who you get the most value from being with, and start there, start small, and be patient with yourself because it is going to take some time to come out of our caves. But we also have to, give a little bit of a push sometimes, just a little bit at a time, beyond our comfort zone.
So the next question I have, I sought counseling in acceptance behavior therapy based on my primary care doctor's referral. After almost a year of biweekly sessions with a counselor, I wasn't sure we were really doing that therapy rather than just going in to talk to someone.
That is a really common phenomenon with ongoing therapy, and I love ACT, acceptance and commitment therapy. It's for anyone who doesn't know, it's sort of like it's called like a third wave behavioral intervention, but basically it's like sort of like an offshoot of CBT with more of a mindfulness twist. There's a very common phenomenon in therapy in general that people often start out with a certain modality, and maybe certain kind of structure and frame and tools. And then the more things go on, the more it kind of drifts to just sort of general, like, let's talk about what's going on that week. Um, and back before I was so strict with my boundaries and session limits, I would see, I may still have sort of holdovers, people I'm seeing on a more long-term basis. And I definitely noticed that happens because yeah, things drift. But I would say talk to the account. If you're still seeing that person, talk to them. Say like, hey, uh, you know, where are we at? Here's what I came here for. Here's what's been working for me. Here's what's not so helpful anymore. Can we kind of go back to that? I feel like we've drifted. Having a direct, open conversation with your counselor or therapist, whoever is going to be, I think that definitely sounds warranted. I think would be helpful.
So we are now at time. It's 12:59. This conversation was like really good. I like this like back and forth. I'm gonna like let you have any closing thoughts and then I'll wrap up.
Well, thank you all for joining. Because we have these big access problems and demand is exceeding capacity, and like I said at the beginning, for anyone who missed it, I'm thinking of starting some kind of some more like online group, um, something that's probably like not something sort of like a hybrid between like a webinar versus like an tight support group that's sort of more probably this kind of format. Maybe there's like a sort of education, knowledge, skills, information piece, and then kind of more of a conversation and application. So if people are interested in that kind of thing, send a message to Dr. Holmes or me. I just volunteered in your inbox, sorry. Send a message to me in the patient portal. Don't send it to Dr. Holmes. She's got enough stuff in her portal. Send it to me. or yeah, and we'll kind of talk about it. I think I'm noodling that over. I think we'll figure something out. All right, happy Friday, everybody. Enjoy your weekend.
So don't mind. You can go on ahead and send it to me too if you need to. Like it's okay because if it's that I know where to put it. So it's all right. It's all right because we definitely, if that's something that you guys are interested in, we definitely want to provide it. And I definitely want to support Dr. Moskowitz and Dr. Park in the wonderful work that they do. And so this is like another way for people to get access. So have a great weekend. It's a 3-day weekend, hopefully, for most people. Please enjoy yourselves. Monday is supposed to be partly cloudy and, nice and comfortable. So definitely get out there, wear your sunscreen. And then in June, I will be in the hot seat talking about Men's Health Awareness Month. So check out for June. See you then. Bye.